I will be performing suctioning of a trach today. So I have gathered my equipment, assembled them onto the table. I have performed hand hygiene, put on proper PPE as indicated in the medical record. I will be now identifying the patient. So, okay, Mr. Jones, I will be explain the procedure. I will be suctioning your trach today here for you. You might have some, if you ever get any respiratory distress, I will stop suctioning, okay? But first, can you give me your name and date of birth? Okay, thank you. I have looked into the patient's medical record and there is an order for suctioning if needed. I have determined that he does need suctioning from his trach. I have raised the bed to a comfortable working height and placed the patient into a semi-Fowler's position. I have already placed a waterproof pad onto the patient's chest for suctioning. I am going to make sure that all of my tools are close by. So, like the ambu bag, an extra trach tube taped over here, the pulse oximeter reading on the finger to assess oxygen levels throughout this. I have an emergency trach surgical kit. And then now the suction, I'm going to make sure it works. I'm going to turn it on, make sure it's less than 150 maximum. So I'm going to turn it on, put on a clean glove.
That it is properly suctioning. Put a glove on. Take it out.
Okay,
Check the
and
suction. Beautiful.
the
It's
suction
working.
is working.
And now I can begin.
So now
perform
remove
hand
this.
hygiene.
Perform hand hygiene once again. And now I can start opening my trach, my suctioning kit.
And the first thing I'm going to do.
Okay, so I'm going to open it.
Within the expiration date.
This is going to now serve as my sterile field. I'm going to remove the gloves. I'm going to opening up the container that will hold my saline fluid, making sure to not contact the inside. I am going to get saline, and I'm going to make sure that it is facing my palm and it is unexpired. I will be pouring into my container that I will be using to check for suction and for priming the suctioning kit. Before I put on my sterile gloves, I will be putting on appropriate face mask, goggles to prevent any secretions getting onto my face. Okay. Okay, I'm going to make sure to just use the 1-inch borders to open up. Okay, non-dominant hand.
Alright, I'm going to take my non-dominant hand. Inside, put it on the dominant hand.
These are new.
Lock this over
Okay.
the cuff.
Making sure to not contact with the sterile outside.
I take my non-dominant hand, which is not going to be my clean hand. We're going to have to suction.
Okay, I can now discard of this.
You suctioned it up. Okay, great. I just
And
have to
now
suction.
I will
Now
be
I'm gonna use this and
getting my
this area.
suctioning.
Remove this.
My left hand is going to remain clean and my right hand will remain sterile.
I'm going to stabilize the trach.
So I want to get it into a good position where I
And I
can
would use this
access it and connect it to the suction.
to make sure that the
Okay, so now my hand will lose sterility. I'm going to connect it
Do you want to go back
and I'm going to prime it with saline, making sure that it works. Using the white port.
That's fine. Like, yes,
Okay,
I
suction
should.
is
Yeah,
working.
I'll put that in my critique.
Now I am going to
This is
remove
like
the
hardest
oxygen.
part is like manipulating
I'm going
this.
hyperventilate with my left hand. That is clean.
It should, or you should start C-seconds, because like.
I'm gonna give 3 to 6 breaths.
No, I keep. Okay, yeah. So right now, I am inserting the sterile catheter in
Okay,
here.
remove it.
Into this predetermined hand.
I will now be
This is still
inserting
my
it to the
sterile hand.
predetermined length.
In between suctioning, I'm gonna use the ambu bag. Okay, once I give breaths, I'm gonna gently remove this, keeping in mind to have.
Okay, it is to the
transported.
predetermined length. Now I will be
I'm gonna
pulling
do another
with
pass. You can
suction,
do upper and during
no
this
more than
time,
10 to
making sure
15
that
seconds
it's
at a
sitting
time
and touching.
as I aspirate in circular motions and plug the Y port.
Pause it. What? All right. So-
Okay. I will hyperventilate again, 3 to 6 breaths.
Now that I finished with the ambu bag, between each pass, you have to clean this out. So again, get a suction in, put it in sterile saline, make sure you get all that gross stuff out.
Okay.
And then I do
And
that for passes
I will
too.
assess if the patient needs any more suctioning. Patient does not need any more suctioning, so I will place the oxygen back
Okay,
and
now can start
I will
suctioning
disconnect
again.
and wrap it in my glove and discard of it
I'm done with
appropriately.
that pass.
into
And
the
then
glove.
What I'm going to do is I am going to dispose of this since I'm only.
And
doing
if
two passes.
additional suctioning was needed, I would wait between about a minute between
What you
suctioning.
can do is clean the mouth, so for that example, I would.
Okay, so I would discard
Again,
of
I feel
this.
like you should clean it
I
out
would
before
perform
putting it
oral
in the mouth.
hygiene for the patient. Okay, so now I'm going to get the patient into a comfortable position. I will raise the side rails, lower the bed if he wanted to, lower into safe position. I would turn off the suction since it is done. Now I would reassess the patient's stats, check for lung sounds, making sure he sounds a lot better, checking pulse ox. So now I will remove PPE, discard everything, and hand hygiene. I will be providing trach care today after suctioning. So I have gathered my equipment, assembled them at a comfortable height on my working table. I will be performing hand hygiene. I will be putting on any PPE that is indicated. I will go into Mr. Jones's room. I will be explaining the procedure, but before that, can you identify yourself? Give me your name and date of birth. Okay, thank you. Today I will be performing a trach cleaning for you. If you do get any respiratory distress or anything, I will stop the procedure. Are you in any pain? You're not. Close the room for privacy. I have put the patient into a comfortable position for me, elbow height, semi-fowler's position. I have lowered this rail. That rail is up. There is a trash receptacle close to me, ready to go. I'll be putting on face protection, like my goggles,
How are you today?
making sure I do not fog. Now I will be opening up my trach kit and all the supplies that I need for emergencies. Of course, I do need my ambu bag. I need a trach surgical kit. I need an extra trach within access for me. We're going to be assessing pulse ox during this time. Okay, so I will now open up my trach tube with aseptic technique away from me. I will open up my new trach, which is here, but it is new. It is new. So now I will grab the saline, tag facing my palm, pour about ½ an inch into here. I will now put on disposable gloves to remove the trach that is currently in the patient. Okay, so I will remove oxygen for the patient.
The suction?
I will hold the faceplate. I will remove the trach, which isn't there because I'm using it, but I would remove it along with the dirty gauze, and I would dispose of it. I'll be performing hand hygiene once again. I will be now putting on my sterile gloves, making sure to just touch the one in quarters that are here. Okay, I will be using my non-dominant hand.
From here, I would open up my supplies. So. Sorry. You know, you do like, I will use those gloves anyways. I can't today. Okay. Wow, dear Lord. You know, like, I'm about to relax alright. From here, I would open up my supplies. So, the suction catheter kit, we're assuming that this is open, it's dry.
Okay, sterile gloves are on. Okay, we will discard of this. Not leaving my sterile field at all. Okay, so now this is going to be my clean hand and this is going to be my sterile hand. I will use my clean hand to grab this sterile trach tube. Now I will be inserting it. I have to make sure I hold the face plate. Okay, it is nice and locked on the patient. Going to be giving him some oxygen. Now I'm going to be applying the clean dresser and holder. So I will once again remove the oxygen. I will be using my clean cotton tipped applicators and I will, this is now a clean procedure. So I will soak them here. I will work in quadrants, working from the inside outward. Okay, dispose of this. Grab another one, soak it. Okay, working outward. Okay, and now I can clean the face plate if it is dirty as well. Okay, I will use the gauze to pat it dry before using the pre-arranged. Okay, so that is all dry. Discard. Now I can put the pre-arranged gauze to go around the tree.
Clean hand, foil it, dominant.
So now I will be removing the holder. I will hold here. I have my extra holder. If I did have it, I would remove one side.
Yeah.
I would be removing one side at a time, putting it on, slide it under the neck, and work on the other end. And once it's on, I'm going to make sure that I can slip at least one finger under here. I can reapply my oxygen for the patient. I will be removing my gloves, removing my face shield. I will get the patient into a comfortable position, lay them down, side rails, lowest position for safety. I will now reassess that everything is okay with the patient, check their O2 stats, check for lung sounds, see if they have any difficulty, check their respiratory rate, their effort. Now I would remove any additional PPE and perform hand hygiene.